Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an April 8, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. As of April 8th, Dubuque County has 28 cases. No new cases were added today. The state added 97 positive cases today for a total of 1,145. One more death is reported in the state for a total of 27. In all, there are 12,821 negative tests and 104 cases are currently hospitalized. The Iowa Department of Public Health is collecting COVID-19 data on a regional basis through the Regional Medical Coordination Centers staffed by Iowa Department of Public Health and National Guard. And it's to provide all response partners, such as local public health agencies and hospitals, at all levels with accurate healthcare information and readiness in collaboration with the County Emergency Management Operations Centers and to coordinate medical resources, planning, and care within the regions. Hospital and long-term care center information is collected daily and tallied on a regional basis and is used for the purpose of surge and capacity planning and to assist with PPE resource distribution. Dubuque County is in Region 6. The news media is reporting a lot about vaccines and medications to treat COVID-19. There is so much research and development going on all over the country about antiviral medications, even at our own University of Iowa hospitals and clinics, to treat COVID-19 cases and in vaccine development. The FDA is even making some of these research approval guidelines more streamlined. So the first step in either of these processes is the research to find out what works. Then it has to be tested to make sure it's effective and most of all, safe. We don't want to create drugs and vaccines that cause harm, and that includes side effects or lifelong health problems. So the safety and efficacy verification needs adequate time and of course people to test them on. You can make a vaccine against anything, but the time it takes to develop is also dependent on if or when the virus changes, along with a lot of other factors. But the most important thing is that the vaccine is effective and safe. This is a long process that can take months to years, even under optimal conditions. As an example, it took over 10 years to develop antiviral medications for HIV. After the vaccine or drug makes it through all those hoops, it still has to be manufactured and produced. There are limited vaccine manufacturers and their capacity for mass production will most likely need to be increased. I'd like to end today with a reflection by Brene Brown. This pandemic experience is a massive experiment in collective vulnerability. We can be our worst selves when we're afraid, and our very best, bravest selves. In the context of fear and vulnerability, there is often very little in between. Because when we are uncertain and afraid, our default is self-protection. We don't have to be scary when scared. Let's choose awkward, brave, and kind. Thanks for tuning in today. Let's all be safe, be smart. When in doubt, don't go out. And remember, we're all in this together.